Aspirin use is widespread and often even used daily, but along with the benefits of aspirin comes some major risks as well. Here to explain both is Dr. Robin Matsukawa, internal medicine physician at Castle Primary Care of Kaneohe. Good morning.
Good morning.
Thanks so much for joining us this morning because, again, as I said, it's widespread. A lot of people do take aspirin daily. So for those who do, why might they?
Some common reasons people take aspirin daily are, say, you have arthritis, joint pains, or even a headache. Other people, they've heard, somebody so-and-so said, it can help prevent heart attacks. There's even some research out there saying maybe even prevent colon cancer.
Oh, wow. Okay, so a lot of people talk about that, but what is the truth? What are the benefits of taking aspirin?
Well, the benefits of taking aspirin are mainly seen with patients who have already had a heart attack, had a stroke, had a bypass, maybe they have known vascular disease and the doctor actually told them to take it. Another reason is for those who didn't have a heart attack, didn't have a stroke, or didn't have surgery, is that they're trying to prevent heart attack because they're in a high-risk category.
Okay, and that can help, right?
That is correct.
Okay, so those are the benefits, but there are some risks that come with taking aspirin, even once, let alone daily. So what are some of the negative side effects?
So yes, negative side effects include easily bruising. Other people, more serious side effects are like gastrointestinal bleeding. So that includes your stomach, your liver, your gut, your colon. Or even more severe is if you have unknown bleeding in your brain.
Oh, wow. That's obviously very severe. How would you know if you're having any of these negative side effects? Would you feel it?
You may feel some things. So if you had bleeding in your stomach, you may notice some upset stomach, maybe pain in the abdomen, especially after taking aspirin. Other things are even blood in the stool or even dark black sticky stool. So not just black stool, but black and sticky stool.
Interesting. And then what about the brain bleeding? Would there be a way to tell?
You can, common things that people think of, I got a bleed in brain is like headaches, but it's gradually worsening and just not getting any better. You're taking more aspirin and it's like, my pain is getting better. You're confused, maybe dizzy, so numerous.
And is that a common side effect?
It's not that common, but it's not uncommon.
Okay, good to know. So because a lot of people, again, do take it daily, but some may have not been told to take it daily. If maybe someone's been taking it and they think maybe they shouldn't have, what should they do?
First off, at least at most specialists and specialty physicians will say, don't stop just because I said it. Make sure you discuss or consult with a physician.
Okay, good to know. So the main thing would be talk to your doctor, right?
Always.
Okay, would you say the benefits sometimes outweigh the risks for this one?
If you have a good reason and your doctor told you, then yes, benefits outweigh risks.
Okay, and with some of those risks, the gastrointestinal ones, can you prevent it? Like, is that why you're told to eat food while you take medicine, or is that something that may just happen regardless?
Well, there are actually different formulations of aspirin that have what they call EC or enteric coated. That's supposed to decrease its harmfulness, at least to your gut.
Okay.
Other people receive what they call proton pump inhibitors or acid suppressors for stomach in hopes that it might help prevent those such symptoms.
All right, good to know. Well, thank you so much for coming in and joining us to break this down because, again, a lot of people, even here in Hawaii, of course, take aspirin daily. So it's good to know both the positive and the negatives of aspirin. All right, thanks so much, doctor.
Thank you again.